Now, 5 days ago, a landmark ruling was made here in Kenya. The Agha Khan Hospital in Nairobi was ordered by the courts to fund the upbringing of a child who was conceived after a long-term contraceptive implant on her mother failed. The High Court directed Agha Khan University Hospital Family Planning Clinic to pay the woman 4.3 million shillings to cater for the unplanned child. Now, it's a case that has provoked many questions, including how usual are cases of botched birth control. Why did this one stand out? It is a case that now gives precedence to such cases. Sharon Momanyi now explores.
It is a case that High Court Judge Justice Hatari Waweru in his ruling referred to as unique. In July 2011, the complainant, a woman, is said to have consulted the Agha Khan Family Planning Clinic for an appropriate contraceptive method. She did not want to have any more children as she and her husband already had 2. The woman was advised that the insertion of an implant known as implant would be the most suitable and appropriate method for her, and that the same, if implanted, would protect her from conception for a period of 3 years from the date of insertion. And so she had the procedure done at the hospital. She is thus said to have been unpleasantly surprised when she conceived 1 year later.
This is an an office procedure. Can be done in any setup as long as there is sterility. So you put anesthesia under the arm, a little prick with some medication that numbs the area. Then you may make a small nick or a cut at the site and then introduce the implant through that cut.
The woman sued the Agha Khan Hospital, saying that due to the unwanted pregnancy and subsequent delivery of the unplanned child, she suffered emotional pain, distress, psychological damage, financial hardship, stating that the child has caused a steep rise in family expenses and thus their quality of life has been compromised. She further says that the unwanted pregnancy created a strain in her marriage because her husband thought that she had lied about getting the family planning method. She was therefore seeking appropriate damages for all that, including the cost of bringing up the child from the date of her birth until she attains the age of 18 years. The court awarded the woman 500,000 Kenya shillings for pain, suffering and lost amenities and 20,000 shillings a month for 18 years, which amounts to 4.3 million shillings for the cost of raising and educating the child. Other tests conducted at the Agha Khan Hospital confirmed that no implant had been implanted in her arm after all. One would wonder, how can this happen when the complainant says that she actually went through the procedure?
It is not unusual that occasionally you may feel that you have plunged the implant when actually you come out with your introducer and the implant follows you back with the introducer. So it all depends on the skill and the training of the individual.
Over the years, Kenyans have increasingly taken to family planning methods, defying age-old taboos on contraceptives to manage their families better.
Is satisfied that the method they're about to give.
Dr. Francis Odawa, an obstetrician and gynecologist in Nairobi, says that women need to be properly informed while making family planning choices.
Any woman contracepting should know that nothing is 100%, but the level of effectiveness varies from one method to the other.
Knowing this, does he think that this particular case sets precedence to such cases? And would it change how they engage with patients for fear of litigation?
That borders on what we call consent. That you have explained to the client what you are going to administer to them, what it is able to do, some side effects that may be associated with it, and up to and including the likelihood of failure. All right? And therefore, the level of efficacy or effectivity. Once you do that, the client should actually append their signature onto that consent form. And that's why I bring in the issue of how sure are we that this implant was not in place? Could somebody have removed it for mischief? And to the extent of going to the courts, maybe somebody had a conceived idea of what they wanted to do. I'm not judging, but we have to rule out those possibilities as well.
The case has raised many questions about how far the responsibility goes for family planning service providers, but the impact this will have, if any, on the uptake of such services remains an unclear diagnosis. Sharon Momanyi, KTN, Nairobi.